I mean, Seth, we have had many a debate, Heather and I, but she is now switching some roles, so she might have a whole different perspective on it. I don't know. Maybe. I mean, we'll see.
Yeah, we'll see, depending on how the conversation goes. The beautiful part of my relationship with Ben is that we tend to have opposite views. And then Tina jumps in and tries to just, smooth the waters and help
Keep the
everybody see
peace.
each other.
Just playing my middle child role, just hardcore. Lean in. It's me.
At one point during one of our podcasts, I believe I said to her, I cannot believe you're taking his side. I'm not sure that we actually published that part of it.
We've never, and our relationship has never recovered. No.
It's so true.
But she sent me some lip gloss, which kind of made up for it. So
yeah, see?
Feel better about that.
I'm a bridge builder too, Seth.
I'm excited to be part of a podcast in which parties need to be separated occasionally.
We'll see if that happens today. We were actually in person, so it was even better when we did this one. Heather's in Nashville, and we were in a recording studio, and it was epic. I mean, that's like irony there, but I mean, it was very good. It was a good heated discussion. And actually, a lot of the points that we were hitting were points in your article, which I think is also irony. These are kind of the things we were arguing about or talking about. I don't even know where to begin, if I'm honest. Heather comes from a provider. She was the VP of Rev Cycle at Vanderbilt. Although that's soon to change, right, Heather?
Friday.
Probably when this comes out. Yep. By the time this comes out, you will not be there anymore. But you've been in that world a long time. And then Tina and I have been on this other side of, like, I don't know. What have we been in for the last 10 years?
Consulting.
No.
Yeah, what would you call it?
I mean, I don't know.
I guess we're
like in between.
Building
like
bridges. Like Seth.
Tina's building bridges, I guess.
That's what we've been doing.
Hey, we can all only do our best, right?
That's right.
That's right.
I don't know.
And
I try to exceed expectations all the time, but
Okay.
Well,
I actually try to go halfway as much as possible, but
that's right.
This is why we get along so well.
less is more.
Heather, I get the sense that you are doing your best to be adversarial, even being adversarial to my saying we're all just trying to do our best and build bridges.
Seth, one time.
But no, I appreciate it.
Seth.
I appreciate the competitive spirit.
One time, Heather and I did this thing where we were like we were at a big conference that was virtual in the pandemic, and Heather and I were like the panel or whatever. Wasn't just you and I feel like it was.
I think it was just you and I.
And then someone afterwards, they leave comments on like rating what the session was or whatever, and someone goes, "What did they go say, Heather?" It was like, "Oh God."
Oh, something about how you and I were fighting.
Yeah, is this supposed to be an argument? Is this supposed to be an argument? Or was this supposed to be a panel? And I'm like, I don't know. I mean, that's the beauty of that's the fun of it, right?
Coming at it from different positions. We've had some good ones. Like we had one really good conversation, I think, with Colleen from Crow about vendors. We talked a lot about vendors and just, or where revenue cycle was going from a vendor perspective. I thought that was pretty good. You had different opinions about.
Don't get me in trouble now. I'm already in trouble for that. Jeez.
No, I thought it was a very healthy conversation. It's not. You don't always want to listen to two people who just agree all the time. So it's good to. I'm glad that Ben invited me here. Yes. Mostly because when your article came out on LinkedIn, Seth, I saw it, and I don't usually do this in the middle of the day, but I called Ben and said, "You have to go on LinkedIn and read this."
So I will say, for the record, she did send it to me. She was the first one. I was like, "What is this?"
And it was almost like because that was the conversation that we had a year ago, a little over a year ago, and I thought, wow, it was like you were in the room with us debating the points. And so I thought it would be great. I think my second message was, you got to get him on a podcast so we can talk.
It was. No, that's true.
Yeah.
So then I stalked him, which I'm sure there was other people stalking you for various reasons, but I was stalking you for I wanted to hear what your opinion was. I'd love to start, Seth, maybe. We don't do intros in the podcast, by the way, so this may be just to start. We already started. I'd love to hear, though, the origin story. Like, why did you write it? Like, it's a big risk. I'm glad you're still around, which is, that's a good sign. And like, why did you write it? Like, what was your thoughts like going into it? Because honestly, I think for the longest time it's been like, I don't think anyone's been willing to take a risk on even saying the things you said. So I'd love to hear your thought process.
Appreciate it. So I'll try and give a relatively short answer to that. I mean, it's a complicated topic. Hopefully, by virtue of having read the 2 articles, you've got a sense that some effort went into them. So it took some time. And I should also start off by saying I am not a journalist or a reporter. I've been working in health technology for 17 years. Have known Epic from the outset during my time at CVS Pharmacy, starting to work on automation, on e-prescribing, on pharmacy systems there. Like I got to know who Epic was simply by virtue of some of the work I was involved with. Moved over to SureScripts, where I ran corporate strategy, and SureScripts has a very meaningful relationship with Epic as part of its e-prescribing network. So got to know the organization a bit more there, and left to venture out on my own and run a boutique advisory and consultancy 5.5 years ago. And we do a lot of work with digital health startups, health technology companies, investors, and do some work on the health system side as well. And look, you can't help but cross paths with Epic. I have a lot of appreciation, admiration, respect for Epic, and I suppose part of the reason for sharing the background is, I've been around long enough to have a sense of not how and when and where Epic got started. That was before my time, but to know them from a relatively smaller, more modest-sized, successful organization into the behemoth they are now. And certainly I think have heard enough whispers and chatter about some of how Epic behaves in the marketplace to be aware. And it just seemed that was accelerating sort of more and more over the past few years, by virtue of some of the writing that I do for Forbes.com, where I am a contributor. I had people reach out to me and say, if you should look into this topic. And as a result of that, and some of what I became aware of, just through the network that I've built, I became aware of some really, to me, I don't know the right way to characterize them, or the words are eluding me, but I would say some business practices that raise questions and that seem to create unnecessary challenges for health technology companies, for employees, for the ecosystem writ large. And I thought that was important to write about. And I also feel an obligation, given that I've got a platform to do so, that I wanted to raise issues. I think Ben and Heather, as you've alluded to, most of what I wrote about, ultimately, there was very little new there in terms of how people have responded and reached out to me. There's very little new. These were largely seemed to be sort of open secrets. They were things understood, just that people felt that they couldn't talk about. And my hope is that by giving a voice to some of these issues, that we can start to have a dialogue about what we all think about these issues that many people were aware of, but up until this point, nobody could, or very few people felt very comfortable talking about. So let me pause there. Hopefully that wasn't too much rambling.
No, that was helpful, super helpful. I think there's a part of like when any one company gets big quickly and becomes the largest player in any kind of market or any kind of area within a market, I think you're gonna have more scrutiny than you would otherwise. I mean, there's no getting around it. You should. I mean, if we learned anything from the last month, the 14th or 12th largest company in the world probably should have more scrutiny than others. And so, yeah, I think it's kind of leans itself either way. Even if they're the most altruistic company in the world and they're the best at it, it still should mean there should be more scrutiny on it.
I appreciate that. And I should add, it occurs to me that part of my thinking around this, Ben, goes to what you just said, which is larger, more successful companies are going to and should draw more scrutiny in terms of their business practices, how they behave in the market, how they compete. I ran corporate strategy for SureScripts. In 2019, Federal Trade Commission sued SureScripts for engaging in anti-competitive monopolistic practices. Now, that's been settled, and I'm not here to rehash any of that, but I was part of SureScripts, and what I will simply share, having been a party to that, and been involved in running a large company with very dominant or strong market share in multiple markets, I became aware that there are actions and business practices that are acceptable and are pro-competitive, have the effect, or at least we would have argued, or I would have argued when I was at SureScripts, would have the effect of decreasing costs to pharmacies, to consumers, increasing innovation, et cetera, et cetera, et cetera. And then there are certain actions that you tend to want to stay away from and could be perceived as exclusionary or anti-competitive. And so I'm not an attorney. I happened to run corporate strategy for a health technology firm that FTC claims is a monopoly and sued for engaging in monopolistic practices. And having that experience, what occurred to me was that, look, Epic is a very large, successful company, and some of the things that I'm hearing about seem to be either in the gray area or, in fact, into the not acceptable zone. And then it's also, I think, relevant that a lot of not just Epic's success, but all EHR's success, as everybody on this call knows, and I'm sure listeners are aware of, was a result of taxpayer subsidies in the form of the EHR incentive program, the meaningful use program, providing, ultimately $35 billion to doctors and hospitals to adopt and meaningfully use EHRs. And that went to everybody. Epic was very well positioned. There's nothing wrong with Epic's success. They've had a tremendous amount of success.
But we paid for it.
But we paid for it.
At the end of the day, we paid for where they're at today.
We paid for it. Many of us are patients. Many of us don't have alternatives to the sites of care that we have access to. Many of those sites of care happen to be Epic shops. And so it seems that there's a public interest in this. Mm-hmm. And I'm open to your thoughts. Mm-hmm. Maybe I'm reading this wrong. Heather, I'm waiting.
For me, well, I want to first say that Epic wasn't the only organization that benefited from the money that the government was spending to try to get everybody into an electronic medical record just for the ease of patient care and sharing of data. So
yeah, lots of organizations
I do appreciate the fact that lots of organizations
yes,
did.
100%.
I happen to think I've used Epic now for, my gosh, probably 15 years in different organizations, at Kaiser, at MD Anderson, and at Vanderbilt. And I've also used other systems. I worked at Athena Health. I know those systems too. And I have to say that Epic is a superior platform. It's not best. It's not going to be perfect. I don't think anybody at Epic or anyplace else is claiming that it's perfect, but I'll tell you it's a lot better than some of the other systems that are out there. I don't know if it's because of their philosophy and they, spend a lot of money in their, development. That means a lot to them. I know they spend a lot of time with their customers that a lot of other organizations don't. And that could be seen as good or bad, right? I think in your article you were saying, hey, they've kind of brought people in, gave those CIOs a seat at the table. They bring their customers in, they tell them about their roadmaps, but they also spend a lot of time trying to get feedback about the improvement of their systems. And I always appreciated that from a customer perspective. And I like that. I like their systems. I like their progress. I do also have to say I appreciate their not wanting to allow every other system out there to hook on. Because as we've just seen in the last month, that could be very dangerous. When you start to do integrations or you don't really understand the backbone of your platform, that's a security issue. And I think one of the tenets at Epic is just to keep everybody safe, right? Keep the patient's data safe above and beyond anything else. And some of that, it comes with their own internal policies and regulations and rules. And I think depending on where you are sitting, it could be a good thing or a bad thing. I'm not a healthcare technology startup. I'm not trying to figure out a way to integrate with Epic or to augment Epic. I use at Vanderbilt, I use a lot of systems that do sort of hang off of Epic. I see some of the challenges. I do. And you have to appreciate that they're going to exist just because it's an integration. I mean, I remember when I worked with McKesson products, and McKesson would buy other systems and then sort of tie them together, and that was their offering, right? They were best of the breed, sort of knit together. Well, the knitting is not always a good thing either, right? And so it becomes difficult to integrate no matter what, no matter if it's a simple system or it's Epic. So I did. I think I read both of your articles several times. I think trying to have a different perspective than the one that is the user, is the provider and the user of the technology. I struggled a little bit with some of the things that were in there, mostly just trying to understand, for example, the employees that, they can't just leave Epic and go work for, say, a health system. But I think that exists with other technology companies too, where you sort of have, you've agreed to a non-compete that you won't go out and try to sell yourself to your customers or to other organizations that sell the same kind of products. So I wasn't sure how that made Epic different.
Well, we're getting right into it. Let me tell you. No, regarding your first comments about Epic being, the best or being better, that's quite consistent with what I heard, and I mean that consistently across the many different folks from different perspectives that I spoke with. There was a general theme. Epic is the leader for a reason. There was pretty strong consistency pretty strong consistency around the fact that Epic probably has the best product. They certainly have proven to be, I think, extremely strong in terms of the implementation and expectations. They're great partners. And one thing that I don't know if I wrote about or not was just the phenomenal job they do cultivating the power of the network of users and really leveraging and encouraging sort of a community orientation and leveraging the community itself to encourage best practices, knowledge sharing, etc. And so there's a lot of power in that. I want to acknowledge.
Yeah, that's one of the things that I've always appreciated about it is it's, their Galaxy website lets you exchange and review white papers from other organizations and how they're using Epic and different tools that they have. And their BFF program is all aligned to trying to help you get the most out of the system in that sort of community type of environment, like you just said, which I don't know if that exists with other EHRs. I don't have a lot of experience with, at least over the last 15 years, but that has just been, part and parcel of what you get when you're part of the program. The other thing I think is really interesting is they have a pretty robust physician builder program. So you don't have to go to Epic to get your build. You can do it yourself, and they're willing to show you how to do it. And they're willing to share with you what you can do in the system. And it's not necessarily because they want to know what it is. They can't just peek and see what you're doing, but they encourage clinicians to learn how to do the build in the system. And I think that that's incredibly valuable in healthcare systems. And I don't think that gives them a competitive edge in any way, other than the fact that they've seen that the best way to support our clinicians is to give other clinicians access to make it better for their workflows. I mean, we're going through a huge initiative right now at Vanderbilt where we've got physician builders who are trying to help our providers standardize their notes, because it can get unwieldy, right? As we all know, it's the clicks, the alerts, all of that. And we have nothing but support from Epic to do that. I was struggling a little bit with trying to figure out how the good things that we've seen from healthcare systems that come out of using Epic. And then I guess from my perspective, I want to hear a little bit more about, I'm really interested in the employees that are there. Your comment about how they're not able to leave, right? And so this creates kind of an issue for them. There's been a lot of former Epic employees that have gone out and started very, I think, lucrative organizations and consulting firms and all of that. How does all of that work? What was the feedback you were getting maybe from employees that I'm just not aware of? Because from my perspective, it looks like. But
those people,
they have a
just to be clear, because I know a bunch of those people. Those people have to play ball with Judy.
Sure.
So they cannot say anything that would go against what the mothership would say. They have to be still connected to her. It's almost like it's like the Pope, right? You have to be. It's like you're Catholic, and you have to be connected back to them, and like you can't go outside of those bounds. Like I know those guys, and I know a bunch of those people you're talking about
that work for technology companies that are former Epic employees, and anybody who's just doesn't want to burn bridges in the healthcare organization wouldn't go out and say anything about an organization that they used to work for. But I don't see the limitation in them leaving. I guess that was what I was
Yeah,
trying
that's
to
not
get
my
to
biggest issue. If I'm honest, Heather, it's not my biggest issue, because lots of companies, Accretive was the worst. So like there's other companies that have actually sued and gone after people. I don't think that's my biggest issue. I'd agree.
Well,
I think it's not like
mine. I would hate to see that Epic employees would be almost forced to have to work in an environment or to do something that they don't want to do against their will, right?
Yeah, but I think they are. I think Epic is paranoid, and Seth, you tell me this, about any IP walking out the door in any way, shape, or form. And so they've made this yeah, but to the nth degree where they've made a list of companies now that are like they consider to be direct competitors to them. So, and that's not that to me is like that could be everybody. That list is huge now.
But it doesn't mean that you can't still work with them. I think what they were trying to say was, you just bought a $187 million platform. Here's how you should use it. You don't have to go also
yes,
buy
but that is
these
the direct. That is the direct thing against competition. Then you've not created a free market. It's like there's no free market now.
No, they didn't say you shouldn't. They were just saying, hey, this is the tech. No, they're not stopping you from doing it. I think they're just saying simply, if you're going to use XYZ company, this is what we're doing over here. You have that technology already. If
Which
you
they
want
may
to
or
go
may
out
not
and
have.
you want to contract with them and pay the extra money, you go for it. I think the list was more about you don't have to. See,
I disagree.
I appreciate being able to go to Epic and say, I'm about to buy this platform because I don't see that this is either in your roadmap or available in your system, and for them to turn around and say, but it is, and here's what you need to do to get there.
So,
saved me the money.
There are, well, here's my perspective, and I'm looking at the article here to make sure I'm trying to refresh myself, to speak specifically first to the point around employees. So, Heather, I think, first off, regarding Epic's own employees, they have a non-compete. Regarding not just the language of the non-compete, but the spirit of it, which I think is important to consider. I'd highly encourage you and listeners to check out the Isthmus articles on Epic's non-competes and how they treat employees and former employees. It's pretty shocking. The fact that there are 4,500 named competitors is in the non-compete is fairly surprising, that there are 4,500 of named companies, including Pfizer, Amazon, Microsoft, some Epic clients. I mean, that's quite extensive, and I'm no attorney, but what I have been told about non-competes is there is a question around scope and limitations, and so the question is, why would Epic name 4,500 if the intent wasn't in some respect to create sort of a chilling effect on employee liquidity? Combine that with the fact that Epic, according to the Isthmus article and folks I've spoken with, it is quite litigious, is not concerned with exercising its right, or at least threatening employers about their intent to follow through. So that's one thing. But you're right. Mm-hmm. Many technology companies have that non-compete, have similar non-competes. It's worth mentioning that there are states now, California is the most prominent, who are rendering all non-competes unenforceable, moot, because of the effect they have on job liquidity. It's also worth mentioning that FTC has announced it's, I believe, its proposed policy, and is currently in the feedback process, in which it is evaluating its position and what its policy will be on all non-competes, and in particular, I believe, non-competes in healthcare. So it is not just me or select employees who are concerned about this. Others have written about this. Now, the part that goes well beyond that, in my mind, that has not, I don't think, has been written about elsewhere, is the fact that Epic's customer contracts contain provisions limiting who and how the customers can hire. According to a contract that is publicly available, Epic may choose not to work with or provide training for any former Epic employee employed by you or working with you if such employee is hired less than 12 months after Epic employment. Mm-hmm. So customers can't hire Epic employees readily, and that's established policy. So again, the question is, why, and what effect does this have on job liquidity? Beyond that, Epic also leverages its market power to contractually constrain third parties, as I understand it, consultants and integration partners, from hiring health system employees who are working on an Epic implementation. Given that Epic implementations last 12 to 24 months, we're talking about multiple years and longer. So I understand that Epic has an interest and an incentive in ensuring that its implementations go well and in maintaining its IP and its own advantages, and trying to maintain employees. Those additional two pieces, to me, are I've not been familiar with and seem to go far beyond the typically understood non-competes between an employer and an employee. We're talking about now between non-competes and non-solicitation between a vendor and a customer, and then separately between third-party consultants and third-party technology companies and the customer. And it raises real questions to me around, well, wait, is this right? And how has Epic gotten to this position, and how is it able to leverage its market power, and how has this not been raised earlier? Those are, I think, social questions.
The bigger point is,
questions.
like, these are also kids. Like, we're not talking C-suite level, which absolutely would have some of these requirements in almost any company. We're talking most of these are kids, like, coming out of college. This is their first job because they recruit everybody from University of Wisconsin, which is fine. It's all good. But the reality is, like, most of them are young. And that's what I had the issue when it happened at Creative, is, like, they were going after and suing kids who took jobs. They were, like, 28 years old, 26 years old. I mean, they don't have the money to legal defense. So that would be my other point here, is that it's not like it's, like, senior people like Heather, you, and I. It's like this is people who probably have been working 2 to 5 years. And they can't work in healthcare. So what are you going to do? This is the job you took.
Well, you can't leave to work at an Epic shop if you leave Epic. You can't go work for a customer.
You can't go work for the
you can't go work for a third party that might actually
so,
it's
well,
exponential.
Actually,
I think is the issue.
You can work for a third party, if I'm understanding what Seth just said, as long as you're not going to be back into the Epic system, right?
Yeah, so but that's the knowledge you know.
That's the knowledge. Well, right, and that's
so
the
I get
protection of the that's the IP protection, right?
I know, but let's just say I'm Susie. I just graduated from college. I don't know. All my friends are going to Epic. This sounds like a great place. I go to the campus. It's freaking awesome. Look at this place. And I get the job, and I'm like, this is fun work. And I become an expert in cadence, let's say. And then I leave, and you're telling me I can't. You're telling me I can't use this knowledge in a way that would, like, help other people. So that's what I'm saying.
You
or
could.
Even if they could,
they get
scared.
To the system.
Yeah, but they get scared because then it's like, well, we got this non-compete, and I gotta get a lawyer now, and okay. This is what I'm saying. It's like I think what Seth is trying to point is like, this is actually very similar to the way a Creative was run. And I don't think it's run anymore like this. But this was the exact mentality they had: was scare the hell out of you. And then sue some kids that are 26 years old, and look what we did to them. Where they're sitting on the sideline for 6 months, where the other employer who was going to hire them can no longer take the risk, and then they're unemployed. That actually happened to a few of our friends, like people I knew.
There was somebody I spoke with who wasn't speaking to this issue in particular, but the spirit remains the same. And I guess the question would be, if Epic has a phenomenal culture, and by most indications it does, has great work, a great work environment, people believe in the work, they are psyched to be there. Isn't that enough to maintain employee loyalty and retention?
No, I think people want to leave for other growth opportunities, or they see something different. I'm struggling because I personally know former Epic employees who have left and gone and worked in health systems, gone and worked for third-party companies that come back and work inside of Epic. I've hired them. I've worked side by side with them. And what is in that agreement sounds like there's more to it than that, because there has to be an exit strategy for those folks, or else I wouldn't know them. I wouldn't have been able to use them in health systems or to use them as contractors. If everything that's simply written there is just on face
Heather,
value.
I think it's just changed a lot in the last couple of years. I don't think it used to be that. Unless Seth, you tell me I'm wrong. I think it's changed dramatically in the last couple of years.
Well, I think it's changed since they went through that issue with the third-party organization that was basically stealing the data through their relationship with Kaiser, right? I mean, is it Tata that they had a lawsuit against? And they were, according to the lawsuit, stealing intellectual property. So I'm sure they did put some level of lockdown. I've seen a change at Epic since that happened. There's more stringent guidelines on who's in your system and what they're doing and what they're able to see and what they're able to extract. And I could see it.
So I think the Isthmus has done really fantastic reporting on this topic. They've done it recently, I believe this past fall. They've written pretty extensively. I'd encourage folks to take a look. I think Epic, my understanding of the Epic Tata situation gives every incentive and encouragement to Epic to ensure that it is able to control or have some measure of confidence and control over its IP. It also sued Tata and won. And so there was recourse there. Hopefully that's an instance of a bad actor. Again, I think, many companies use non-competes. The question is whether, non-competes are sufficient, whether non-solicitation between vendor and hospital customer are sufficient, and then how and why Epic feels it is necessary to put in effectively non-solicitation between third parties and health systems. Mm-hmm. And that, to me, that feels a bit much. But what I would say is, look, I'm sure that, of course, we all know former Epic employees. The question is, how many more would there be? Or a question is, how many more would there be had they felt like they had options? And how much more innovation might there be if they felt like they had the potential to go out there and do their best, and they weren't tied or constrained in their options?
But wasn't that Tata group exactly what you just said, that they put the provision in the contract because it was a third party of the customer, right? It was a third party of the customer that came in through the system.
Yeah, but that was different than employees, and I don't want to get too belabored in that.
The second part of it, I think, is, that's going to prevent a lot of third parties from being able to access the system, right? Because if the customer doesn't feel like that's something that they can do, if the employee feels like they can't, then, I guess you're going to have to figure that out. I have not been challenged by getting third parties into Epic to help us with something. I don't know if they're former Epic employees. I would assume we would probably want them to be, because if you're inside of Epic, it's good if you have the knowledge.
Well, you mentioned as well, Heather, this idea of that for you to be able to go to Epic and ask them, mention, hey, I'm looking at X, Y, or Z solutions. Do you have this? That there's value to you in knowing that. Did I follow that correctly?
Yes. It's going to save health systems money if I don't have to go spend money getting a third party to do something that I know that Epic can do. So I think that's the relationship that you've had with Epic is a great one, and as we've talked about, I think it's a key part of the reason that Epic has had a fair amount of, it's considerable, more than a fair amount of success. My understanding and where that begins to become problematic is a couple of things. Perhaps primary among them is that I heard from
many constituents on different sides, not just the health technology or digital health side, but also the health system side, that Epic is fairly assertive, if not aggressive, in pushing out new products, and that it frequently ties the adoption of a new product to aspects of its core product in the form, and so literally there's bundling or tying in which Epic says, if you take this, we'll give you preferred maintenance status on the core EHR. Or there may be, as I understand it, a rebate that applies to the core or overall license. Now, there are antitrust attorneys who should, and presumably Epic's engage them, so it must feel it's on confident ground. My understanding, it being in a similar situation where they're running strategy at a company that had a very strong market position in one product, was you can't tie the adoption of a new product to benefits in the core product where you have a dominant position. And that is something that from many different sources, Epic appears to be doing. And if it is doing that, a question I would ask is, well, are the new products, can the new products not win of their own merit or on their own merit?
I don't know the answer to that. Heather, you'd have to answer.
So, I don't know about rebates and discounting and all of that. I don't negotiate that for our Epic instance, but that is pretty much how all vendors work, right? I've got 5 modules. If you buy 4 of the 5, right, well, it's going to be this price. If you buy 5 of the 5, it's this price. I don't know if it's anchored in a benefit to your core or if it's changing it in some way. I don't know about that. But I will say that the system is designed to be incredibly integrated so that all of the modules work together. And that's probably intentional because, look at systems that are not integrated. That's a huge problem. I've worked with systems that weren't integrated. I remember one time their emergency room system couldn't work with their inpatient system. And so when you moved a patient from their emergency room bed to an inpatient bed, all their meds dropped. And you'd have to reorder all their medications because the interface didn't work appropriately, right? Well, the whole idea behind Epic is that it's integrated. And so I think the modules that you purchase obviously have an integration into existing workflows. And it's also supposed to be more efficient. I don't know about the pricing issue of that, but I understand the premise behind it. And also, I think I would look at it from the perspective that, health systems margins are razor thin. Razor thin. We just don't have millions of dollars to buy new technology. We also don't have the resources to implement it all. And so it's natural, and I think it's in good faith for spending the money that we do have to try to improve patient care to be the most economical that we can. So I always ask, do we have systems and tools in place that can do this now? And if I can get a system or a tool in place and I don't have to pay extra money for it someplace or do another implementation or think about sharing my data, sharing my patient data with yet another vendor to have it stored in yet another server system someplace, to have it potentially breached, that's me trying to protect the health system and my patients. So I appreciate if Epic says, hey, we have a module that we think can help you, and because you already have this, or this, it comes at a discounted rate. You don't have to, it's not a full implementation, so we can discount that. I see that as a benefit to health systems. I don't disagree,
Heather. I agree with you. So I do agree that there is this whole piece. I do think it gets to my core issue around the whole thing, is that they are the keeper of innovation. No, I get it because you have them. You're stuck with you got it. meaningful use helped us all get to this EMR. So, but you are beholden to them. Like, whether you like it or not, you are beholden to them innovating. Not anyone else, not a free market, them. And so that would be like, again, and I'm not saying they're bad people or like they're trying to do intending bad things. That is not at all what I'm saying.
I don't see them.
You are 100% beholden to them.
Well, because the health
because
system
you can't afford, you just said it, you can't afford to go
right.
outside of them.
Well, you can't afford to switch off of Cerner either, or you can't afford
100%.
to move from Athena.
100%.
You can't afford to move from IDX. So it's not an Epic thing, I guess, is my issue.
Yes, but it is to a degree, because Cerner's much more used to like using other third parties, which you made a good point. Sometimes it's challenging and painful.
So what does Cerner say to their employees about non-competes? What do they say?
I don't want to talk about non-competes anymore. That's irrelevant. I want to talk about innovation. Because I think that's the biggest issue.
Anyone is going to keep you necessarily from innovating. I've never felt as though using Epic for the last 15 years, I couldn't do something else.
You don't think another company that you wanted to use that's more innovative, that came up with something new, you're like, oh, I don't want to use those because Epic might come out with it.
No.
Like, that absolutely has happened.
No, absolutely not.
They just came out with 60 things that they're like, we're going to use AI for this. And I'm like,
and
okay,
Epic
when are those 60 things going to come?
Epic can tell you all day long what their roadmap is. You have freedom of choice. It is your choice. It's your choice
I totally
if you want
agree.
to put in a homemade automation where Epic may or may not automate something, it's up to you. If it breaks and it doesn't work, too bad for you. So if you want to go out and buy another vendor to do a certain thing that Epic maybe doesn't have today, but they're telling you will have tomorrow, you have free will to do it. If you want to put the interfaces in place, you want to put the effort in place to get it done, you go for it. But if they do come out with something that is superior in the end, you're stuck with whatever system you have. You always have the freedom of choice. I've never felt like Epic has taken away my freedom of choice to choose a vendor that
you're missing the point. You're missing the point. Okay, you're totally missing the point. The point isn't that you don't have freedom of choice. No, the point isn't that you don't have freedom of choice. You do. The point is that there are companies that will never start. This is our point from Nashville, our conversation before. There's the companies that will never start because Epic said one thing on an article at HIMSS this last a week ago. They said 60 things they're going to go build. Whether they build them or not is irrelevant. They may not. They may never build them. The reality is, anyone who was thinking, I'm going to go see if I can innovate on that, they can't do it anymore because they're like, well, they just took the market.
No, it's not that they can't do it. No,
they did because I'm a business person. I can't go just do it because if Epic decides to do it, they can just ruin my business tomorrow.
What if you can do it more efficiently? What if you can do it with better integration?
People like you,
Heather. I can tell you, based on fact, based on speaking with many different people and investors. There are companies on the list in the document that I shared, the 323 products that you can replace with Epic, who are making strategic decisions right now about whether they can stay in business or whether they should exit because their product is on that list, even if it's just been announced. Well, I can tell you that Epic has a playbook that seasoned investors and entrepreneurs who have faced this before understand what the playbook is. What Ben is describing is real, and it's real because Epic, we can agree that Epic is very effective at communicating to its customers and prospects what is on its roadmap. And at times, those products that are announced that they are coming, they don't arrive for 2 or 3 or more years or whatever it is.
Very true.
And the playbook is precisely, I'll be writing about this. The playbook as conveyed to me is the first thing Epic does is announce we're coming out with this. They don't say when necessarily, but it's on their roadmap. I don't recall, I think 5% of the products on that list were new, under development. It's unclear when they will be announced.
Right.
At that point, the health tech company in that space who's affected doesn't lose sales. They just start to see sales cycles lengthened, because some CIOs or VPs will say, well, really, really like you, but, we're going to hold off for now. So the company doesn't lose deals, they just see sales cycles lengthened. In the second stage, Epic introduces a product. It is oftentimes far inferior. It is priced on an inferior basis. There may be bundling or tying at that point. There may not. And the company, the CEO, believes, look, we can outcompete Epic. It's not a great product. We are far superior. We've got more advantages, et cetera, et cetera, et cetera. And at that point, the company doesn't lose many deals, but sales cycles lengthen, and they start to lose. They lose a few to Epic. And then the third stage is when Epic goes full bore. They've matured the product. They've narrowed the gap to maybe where they can meet 60 to 80% of the functionality, and they start, as has been conveyed to me, they tap into every tool of the trade to leverage the existing market footprint they have, the relationships with customers, and the strengths that they have, including their core EHR maintenance contracts, and what you just mentioned, which is integration, offering themselves, of course, as probably is entirely reasonable, superior integration than a third party can ever hope for. And that is when it starts to, the company and the board realizes, okay, it's game over. And so to Ben's point, when Epic now announces that certain products are on its roadmap, there are investors, absolutely, who will stay away. It's effectively a blacklist of products and investments to stay away from because it no longer makes business sense. So a question is, while it is natural that Epic should be able to, that customers should have choice, that it is helpful for customers to know that Epic has product functionality coming, should Epic be able to leverage its dominant product, its dominant high barriers to entry product where it has a durable monopoly, and customers don't have choice, to leverage that to benefit the adoption of new products, one, and to more tightly integrate those products than any third party could ever hope for, and actively disadvantage those third parties. Or should the floor be raised to say, look, EHRs, all EHRs, not just Epic, but should ensure that there is a higher level of interoperability, that they adhere to standards, that they make available connectivity and interoperability and professional services that are fairly made available to all, while also having the right to compete in whatever way that they want, but offering the same or similar types of integration, which I have understood. In fact, Epic actively disadvantages third parties while advantaging itself. And so I think and I've been talking now for several minutes, so I'll shut up, but I think, where Ben is headed, I think is real when he makes the point that, well, over time, what Epic is doing is it's offering a great product, or generally very good products, relatively modest pricing, great service, and they're also increasingly getting hospital customers and health system customers into a position in which they are increasingly beholden, where it's a slippery slope, and it's almost as if the free choice that you said hospitals have to make any product decision almost becomes an illusion of free choice. Sure, there are choices. They're just not very attractive because Epic has tilted the playing field.
But isn't the whole idea behind creating a new product because you think the market wants it? Like, that's the first question when you create something new. Am I going to even be able to sell it? Does anybody even want it, right? That's your first question. Is anybody going to buy this thing, right? Well, I think because of that, Epic is also able to tap into what do people want, and why shouldn't they be able to use their system to deliver the same tool that somebody over here has said, okay, well, yeah, that makes sense that the market wants this. This is, to me, delivering what your customer base is asking you for, and frankly, demanding, because Epic is not cheap. Providers expect that Epic is innovative and first at market and are listening to our feedback and doing something about it. And frankly, I want it for free. I don't want to pay for it. And so because they're out there and they're building and they're trying to learn and they're coming, at it from a perspective of, we want to keep our client base, we want to make this easier for our clients. And somebody out here has also identified a potential opportunity, and Epic comes out and says, we're going to do this now. I mean, I have to say, from a hospital perspective, I'm going to go with Epic because it's already in my system. I get the innovation part of it, but everybody is still able to, if you want to, compete. You don't have to go sell to Epic shops. Go sell someplace else if you think whatever you're bringing to market is going to really help the healthcare system, then it doesn't necessarily need to be Epic. But that doesn't mean that Epic shouldn't be also innovating. Now, I would say, I would be a little bit concerned if Epic started partnering with all kinds of other vendors and hooking their system onto all of these other vendor systems. Again, the number one priority for health systems right now is security. It's cybersecurity. It's protecting the patient's record. And I don't want to share that with a bunch of other vendors who, again, are going to store this in other databases and other systems and Amazon towers and places and servers and countries I don't know about. The more that I can do to secure our patient data, meaning keeping things inside of our walls and the existing infrastructure we have, that's where we're at right now. Maybe that will change in the future, but because of that, there is a cry from providers for Epic to step up and start really putting more innovation in their system in areas that, yeah, frankly, there are probably 35, 40, 4,500 other products out there. I get that when you're building a product, the number one thing you want to know is anybody going to buy it, or is Epic going to do it first? From a systems perspective, from a health system perspective, I'm out there pushing Epic to be all of those companies because I don't want to have to buy something else.
Here's a question. If Epic comes out with a product and another company comes out with the same product and they both ascribe and are certified by the same cybersecurity organizations, they both adhere to the same stringent policies, the products are similar in nature, they both can be integrated in a similar fashion, and they cost similar. And one of them is available today and will benefit patients and caregivers today, and one of them will be available in, we think, 18 months, maybe 24 months. Does that change the dynamic or the decision making?
Sure. Well, a couple of points would change the decision. One being, how critical is the issue we're trying to solve? What's the burning platform, right? Is it something that if it's saving patients' lives and it's available today, then I would say we would be full in, right? Health systems would be fully on board. If it's something that's nice to have, let's take like a CRM type of module where it's just going to link all their patient interactions together. Would it be really great to have? Absolutely. Do we limp along today with that? Yes. We may want to go a little bit longer to have it in one system. There's a lot of factors, and there's also a lot of challenges with bringing new vendors into your system. I mean, our sales process is lengthy, and there's a lengthy cybersecurity review, and sometimes it's done multiple times, and that it's a daunting task to try to get through all those hurdles with a vendor. It's much easier if you're already here. And I think that's where, when I go to Epic's user group meeting and I sit with my peers, we're talking about pushing Epic to do the things that we see are options in the environment that they're not doing now. We're not saying we want you to go integrate with all of these other vendors. We're saying, why do I have to go buy that other vendor's product? Why can't you do it, Epic? Why do I have to have all these add-ons? And I think Epic is reacting to that, which is a good thing, right? But nobody ever stands up in the room when I'm there in front of there's 13,000 people that show up at the user group meeting that I go to every year, and nobody ever stands up in the room and has ever said, how come you can't integrate with this system? They say, I don't want to buy that vendor. I don't want to have to go through this process. Why can't you do what they say they can do? How come you can't do that, Epic? And I think they take that and they build to it, right? And now that's like where you see the list and the roadmap.
But it's like everything that's like every big company that you think is going to should be good at everything. They're never going to be good at everything. Do you remember Amazon actually came out with a phone? Does anyone even remember that? They came out with a phone. Yeah. It turns out they weren't real good at it. And I think like one of the things missing here on the larger scale, because I don't disagree with you, Heather, on a lot of these points. I just think that on the larger scale, one of the things missing here is like Microsoft back in the 80s and 90s. This is a similar situation. Apple wasn't a real competitor at the time. Like it was an alternative, but it wasn't something that companies were using. And until they got a real competitor, it probably made Microsoft 10 times better than today than it was back then. And I think what we have here, I hate to say it, but it's like, you're right. Like Epic is definitely better. It's significantly better. And they don't have a real competition here. And so the only pressure they're feeling is from you. And the 13,000 people you had in a user group meeting, which is pressure in itself to innovate. But it also makes it so that like one group, one company, big company, has a ton of control and can kind of bully themselves around and be bullies in the market, and not even intentionally sometimes, I'm sure, right? So your point from earlier, it's like might not even be intentional. It's just the reality is it is. And so I think that's the other thing that's probably is a bigger piece is missing here is like, it's probably preventing the next, I'd say the next version that's much more competitive, the Apple to the Microsoft.
I don't think so. I think,
and I hope not. I hope that's not true, but I do think that happens.
I would challenge those other systems to be superior, right? Go out there and make your product better. I mean,
I know, for whatever reason they haven't.
Just like, I mean, of the four of us on this call right now, how many of us are using at least one Apple product? I know I have 1, 2, 3, 4 in my purview, right? Mm-hmm. And so where's Apple in this? Like, where is the next Apple? I think Epic is coming from a place, if I had to guess, I don't know Judy. She doesn't know who I am. Hi, Judy. If you're listening, hi. I don't know you. I don't know anything about it. All I know is what I know as a user of the system and a provider in this environment. It is tough out here right now. And I'm sorry if other vendors can't integrate and can't do things that they want to do. I just need this to be more efficient, frictionless, and innovative, and I need solutions now, right? And if somebody comes up with a better product, they need to do it quickly, because more and more systems are moving to Epic because it's superior to what's out there. I would challenge all those other companies that have EMRs to be better.
So, I do want to move to a related topic, but aren't you making the case that Epic is the biggest, Epic is the best integrated, Epic works with the most knowledge, you all want Epic to solve more problems? Aren't you making the case that there are no competitors who can come in and be effective in this market? Because
no,
Epic is the largest, Epic is the best, and Epic listens to its competitors, and you are all asking for Epic to do more.
Yes, I think that they're trying to deliver on the ask. And I think that if there are parts of Epic that they're not going to work on, that they're saying we're not going to try to be the best, we're not going to try to do this, then they do say that. This is not something that's on the roadmap. We're not going to be doing that. And I think there is level of innovation that can occur from that. But you can also choose, if you want to, not go down the Epic path. If your health system has a better margin than others and you have the money to spend to innovate and create and hook on, I think Mayo does a great job of developing products that you can use in the market that integrate very well with Epic, or maybe don't, right? And I don't know that anyone's ever stopped them from doing that. You just have to figure out where you're going to fit into that, where Epic is going, or where you want to go. And if you're going to create a superior product, then you can do that.
So here's then another question, and I'm looking forward to going down this route. So one, Mayo Clinic has resources that many other health systems and hospitals don't have. It's also fair to say that the literature out there suggests that many hospitals, I don't want to say metropolitan areas, many geographic areas have a dominant hospital or health system, not much competition. When we talk about choice, and you've talked about health systems having the choice, at the end of the day, health systems are not end consumers here. Health systems are part of the supply chain, a supply chain that should deliver health to individuals. And my understanding of the way what FTC tends to focus on and use as a benchmark or a threshold for thinking about sort of antitrust and whether there's healthy levels of competition, innovation, quality, et cetera, is the impact on consumer welfare.
Mm-hmm.
We are consumers. There are, beyond this, I believe the numbers are 145 million Americans who receive health insurance. And the numbers are actually probably higher than that because I don't think I included DOD or VA. But 145 million, I believe, is the number who receive health insurance from Medicare, Medicaid, or CHIP. So their insurance is provided directly by the federal government, who seems to have a vested interest. And for tens of millions of these people, they live in a place where there may be one hospital or one health system who is dominant. Now, when we go back to the question of the pace of innovation and whether it matters for the health system or how the health system would think about adoption of a product from vendor A versus from Epic, and vendor A has the same product available today versus Epic having it 2 years out, from a public policy and how that hospital makes decisions, the hospital at the end of the day is just part of the supply chain.
Well, they should be making their decision based on what's best for the patient, always, right? Like I said, there's other criteria, is that going to be the best thing?
But they aren't in competitive markets. So the issue you just raised about Epic not having, the Apple competitor, we have hundreds, maybe thousands of markets affecting millions, tens of millions of Americans who don't have choice over where they go to receive care.
Sure, but how does that have
so
anything
the question
to do
is,
with
should the health
lack of innovation or preventing innovation?
How does lack of innovation in at least two ways? But let's focus. Or my question is about two. One, the IT group in that hospital or that health system where there's very little competition, are they going to go out and be incented to adopt I don't want to call it life-saving, let's not be extreme, but the beneficial health technology that may benefit consumers today, or will they elect to wait a year or two because Epic's going to bring it out, even if all else being equal, the two are the same? Costs, benefits, integration, etc. Two, per Ben's earlier point, if Epic has announced that they've got a product in development, and that CIO, or maybe it's the parent, the group, the corporate, CIO who says, well, maybe we'll wait, we'll give it some more time for Epic, and either that the patients in that area have no recourse, or the business never gets started because investors never decide to pour capital into that space because Epic has announced we're going to do that at some point in the future. From a public policy perspective, should we all? I'm asking. Do we all think that's acceptable and that's an okay place to be, or should we be generally thinking about advocating for a world in which the hospital should be demanding more and more of Epic, but maybe public policy should be demanding more and more also of Epic and every EHR to open its systems, to be more interoperable, to be secure, to increase security requirements. So there is more competition, because the federal government was in large part responsible for the success of Epic and other EHRs, the way the market has fallen out, and as a result of federal policies, it is academic medical centers, health systems acquiring other hospitals and implementing their EHR of choice, Epic, which is part of how Epic is growing, into those hospitals. Should it be public policy to help ensure or to advocate for more competition and a level playing field? I think what you're describing is fair regarding individual health system and executive choices.
I wasn't going to talk, Ben. You talk. Let Tina talk. I have an answer to that question, but I want you guys to weigh in.
Well, let Tina talk.
I'd love Tina to talk.
I have thoughts.
I don't know. I mean, my head goes to I'm thinking I'm sure when they were talking about meaningful use many years ago, and the idea of getting EMRs in place at every, getting an electronic medical record in place. I wonder if they did that today, it would have been different. It just happens to be that we had. I mean, I wonder how many EMRs started, and would they really predict that we'd only have a one or two? In theory, we would have had 5 or 6 that would have been kind of getting market share, and that's. I mean, and kudos to Epic. That's not what happened, And so it's just very interesting if I think back. The advent of meaningful use was a big deal, but it had to happen very fast.
It also came with money, right? It also
that's the
came
point. It's meaningful use, as in had cash.
Right, and I think I hear what you're saying. Nobody cares more about those rural hospitals that are trying on negative margins to make it work, right?
100%.
I grew up in New Hampshire, and there's quite a few of those safety net hospitals, and I've seen some of them be wildly successful by being conservative and maybe sometimes patient, but always being advocating for the patient at the end of the day. I really truly believe that. There are so many decision points to the do you buy it now or do you buy it later? Do you wait or do you not? We talk about this all the time, and I'm sure that those smaller health systems think about it and are up at night wondering, how do I provide the highest level of patient care and safety and quality and do it in a way that I can afford? What is tragic about this whole situation is it comes down to having to make a decision about patient care from a finance perspective. And sometimes you just can't do it. Sometimes it doesn't work. There is no money. There's no way to get a loan. They don't have a line of credit. And I think those health systems are not just probably talking to Epic and saying, I want more for what I've paid for. They want something that they can use that's going to benefit their patients. And now or later, it's a hard decision to make. Do I think that bringing the government in and putting policies around it? I've seen that go a bad way, right? And I've seen that make it better. I've seen it make it worse. So I don't know. I don't know that if we're all in this, because I see a lot of vendors. Seth, and I can tell you now, not all of them are selling products that are going to help patients. And not all of them are selling products that I don't say to myself, we already do this in Epic. Why are you even here, right? And for their own benefit, I always say to them, we do this already. Like, you just have to flip this switch and turn this thing on and it's done. I don't know how they got in front of us, right? I don't know if they didn't do their due diligence. I get confused because I'm like, this already exists. I don't understand. That's hard for health systems when you have to weed through all of those vendors to try to kind of figure that out, right?
Yes. And look, let me acknowledge, I framed that as a very straw man approach, and I also asked, I suppose a better question to ask or way to frame it is, Epic should 100%, as all EHRs, should be 100% free to compete and bring new products to market and meet their customers' needs. Is that fair, uncontroversial?
Yes.
Yeah.
In maybe an ideal world, we also would have a burgeoning market of other companies out there bringing solutions to market, many of which are going to not be competitive or totally unrelated to what Epic does, and some of which are going to overlap with Epic. And I think we'd all want there to be a competitive marketplace where the best solution may win.
Sure. Yes.
So a question, I think probably maybe the most relevant, maybe the only relevant question is, do we believe that Epic is competing in a way that allows for that competitive market to emerge and forces Epic to be its best? Or are there things that actions that Epic is taking to stifle innovation or reduce the likelihood of innovation? And are we okay with that?
Yeah, those are good questions. And I think even if we don't debate like some of the actions they're taking, just by the merits of having market share they do, and the switching cost of switching to another vendor or another EMR is so high, right? The switching cost is something that I'm always like, that is what kind of makes this a very, like, to Heather's point, majority of health systems aren't going to be able to, no one's going to afford that, right, to switch. Although we've known some that have, but that's rare, right? So I think just the nature of,
turns
like,
your organization upside down. And
you could just, you might as well just count it out, right? So that's why I think the sheer nature of just how they have the market, even if they did things that were, allowing innovators, it still is difficult, right? So, like, I think the latter is correct, but I also think, like, even if they're not intending it, it is going to be difficult. It's not a total free market. It's very similar to Windows and Mac. I mean, that is ultimately where we're at, unfortunately.
I think that's fair. And we haven't talked about, examples, for instance, such as whether where Epic has a new product and there's a competitive product. There were instances reported to me that I shared in which the API fees that Epic charges to a third party are such that Epic would not be able to run a sustainable, successful new product as a financially standalone product if it were charging itself. So it appears that in some cases Epic is charging the third party for access to data that it has in its core product, or the ability to integrate and interoperate in a manner that either the third party results in the third party having to raise prices substantially or run an unprofitable business. And so whether there are integration tactics, et cetera, that maybe is more tangible. And the question is, do we think that's an okay place to be? And and look, this is reported. If Epic were to come out and say, nope, these are our prices. Here's what they are. Here's what it looks like for ourselves. Transparency, I think, would be helpful. To me, that's maybe a more tangible example in which, Heather, the hospital may, a health system may say, oh, well, sure, we're going to go with yours. It's lower cost. Well, but wait, from a broader perspective, is that the scenario we want, in which Epic is taking actions to actively disadvantage competitors in a way that doesn't benefit anybody, but does increase, using Ben's language, does increase the degree to which the health system now is beholden to Epic.
Yeah. We do have to wrap. So,
oh, gosh.
Yes.
We're coming up against it. There's a lot
here.
here.
You said we wouldn't be doing this until 5.
I know, but we're like...
Seth, I'm so glad I got to meet you. I think you're awesome. I really do. I love everything we talked about. I could probably talk to you all day. I think you're great, and you're brave, and I appreciate the hour and a half that you've given, and I think it's awesome. Thank you for bringing a different perspective. I really do appreciate it.
Thank you. And by the way, vice versa. Like I believe really strongly in the power of dialogue and discovery and learning, and I actually, hopefully, what came through in the articles is more balanced perhaps than I presented here, because you have a strong perspective, and I found myself trying to ask questions or trying to persuade, and in fact I'm not trying to do that. I think both sides should be presented, and hopefully this is the start of a broader dialogue. But this was wonderful. Yeah. Thank you, Ben, Tina, and Heather.
Yes.
Yeah, I think trying to close it out. I think that it is one of those things where like I would appreciate just more dialogue, so that we're not even thinking things about a company that may not be true. Like I think part of the challenge here is I don't hear from Epic on any of this stuff. It's not like they're even responding to some of the things that are coming out. And I think there was more dialogue. It'd be helpful. It'd be like, hey, actually, here's what we were doing here. This is what our intention was. Oh, okay, that actually makes more sense, because I'm sure there's another side of the story, right? And to Heather's point around, the Tata thing, like stealing data, like, yeah, there's probably another side of that story, that the reason they're doing some of these things. And that to me is like why I think that conversation's important, because like I said in the beginning, I think that any company that gets as big as you get and you get as dominant as you get, you should have more scrutiny to it. And change was an Optum, and United was honestly example number 1. We had a lot of scrutiny around that thing, and look at where we're at now. So, there's a lot to learn from that, I think. So hopefully this was helpful. We'll probably have to split this in 2 parts. Thanks so much, Seth, for coming on, Heather, for being a guest. We appreciate it.
Absolutely.
And
all I did was
we'll
show
talk
up.
to everybody next time.